Hello everyone. Today, we're going to talk about a complex but very important topic, borderline personality disorder. What is this disorder? What are its symptoms? Is there a treatment, and if so, what kind of treatment is applied? We'll also discuss the challenges of living with someone who has borderline personality disorder and what can be done in such situations. I'll try to make this topic more understandable with examples from everyday life. If you want to learn more about this disorder or know someone who has it, this video is just for you. If you're ready, let's get started. Borderline personality disorder is a condition where individuals struggle to control their emotions, experience intense relationship issues, and have a fluctuating sense of self. Those with this disorder live in an emotional roller coaster. One day, they might feel very happy and energetic, and the next day, they could fall into a dark and hopeless mood. These sudden changes are often not understood by others and can be confusing. But these fluctuations stem from the intense emotional turmoil inside the person. One of the most prominent features of borderline personality disorder is the fear of abandonment. Imagine your friend doesn't reply to your message immediately. Most people would think, maybe they're busy. But someone with borderline personality disorder might intensely feel, they're abandoning me, they don't love me anymore. This fear can make them either very clingy in relationships or suddenly distant. Additionally, they tend to see things in black and white. For instance, they might see their partner as the perfect person one day but consider them worthless after a small argument the next day. Another prominent feature is identity disturbance. People with borderline personality disorder struggle to answer the question, who am I? For instance, one day they might see themselves as social and outgoing, and the next day, they might think, I don't want to be with anyone. I need to be alone. This inconsistency can lead to a lot of changes in their life. From career choices to relationships, they may frequently change their mind. Also, impulsive behaviors are quite common. They might shop impulsively, engage in risky behaviors, or eat uncontrollably to fill emotional voids. This impulsiveness can lead to both financial and physical harm. Some individuals with borderline personality disorder might develop suicidal thoughts or self-harming behaviors to alleviate emotional pain. This is a serious symptom that requires treatment. It's crucial to understand that people with borderline personality disorder do not engage in these behaviors willingly. This is a disorder and a result of the intense emotional pain they are experiencing. Empathy is essential in this process. So, what are the causes of borderline personality disorder? Research suggests that a combination of genetic predisposition, differences in brain function, and environmental factors lead to this disorder. Especially childhood trauma, emotional neglect, or physical, emotional abuse are believed to play a role in the development of borderline personality disorder. For example, a child growing up without love and trust might struggle with emotional regulation in later years. Additionally, those with a family history of similar disorders have a higher chance of developing borderline personality disorder. An imbalance in brain chemicals, like serotonin, can also make it harder for someone to control their emotions. Borderline personality disorder is more common than people think. Studies show that about 1–2% of the general population exhibit symptoms of borderline personality disorder. It's diagnosed more frequently in women than in men, but this might be because women seek help more often. This disorder usually begins in adolescence or early adulthood, and symptoms might decrease over time. However, if not treated, it can seriously affect a person's life. Is treatment possible? Borderline personality disorder is known to be a difficult condition to completely cure, but some people can fully recover with intensive therapy and support. Proper treatment can greatly control symptoms and improve the person's quality of life. Psychotherapy is one of the most effective treatments for borderline personality disorder. Especially dialectical behavior therapy, DBT, is effective in helping individuals with borderline personality disorder develop emotional regulation skills and control impulsive behaviors. Cognitive behavioral therapy, CBT, can also help change thought patterns and behaviors. Schema therapy focuses on recognizing and changing negative schemas that stem from childhood. This therapy can significantly help individuals with borderline personality disorder understand themselves and build healthier relationships. Individual therapy, group therapy, and family therapy are other methods that can be used in the treatment process. In some cases, medications like antidepressants or mood stabilizers can be used. However, medications alone are usually not sufficient and should be combined with therapy. The treatment process requires patience and determination, but with the right support, it can make a big difference in a person's life. Living with someone who has borderline personality disorder can be very challenging. These individuals struggle to control their emotional fluctuations and intense reactions. For example, during an argument, your partner might accuse you of not loving them anymore, which can escalate into a major fight. Or they might be extremely close to you one day and completely ignore you the next. These behaviors can be emotionally and physically draining. If you're living with someone who has borderline personality disorder, the most important thing is to be patient and understanding. Try not to take their emotional fluctuations as personal attacks. For instance, if they shout at you in anger, remember that this stems from their internal struggles. However, you also need to set clear boundaries. While supporting them, don't neglect your own mental health. Seek help from a therapist if necessary and remember that you are not alone in this process. Additionally, you can support them by saying things like, "I understand how you feel, but you don't need to feel this way," without belittling their emotions. Remember to break long sentences into at least 2 sentences. In conclusion, borderline personality disorder is very challenging for both the individuals experiencing it and those around them. However, with proper treatment and support, it is possible to manage this condition. If you think you have symptoms of borderline personality disorder or know someone who does, it's important to seek professional help from a specialist. Remember, we are all different and together we make up a whole. Thank you for listening to me. If you have any thoughts or questions about this topic, please share them in the comments. See you in the next video.